I am Sebnem Korur Fincanci, a forensic physician and professor of medicine. For decades, I have worked at the intersection of medicine and human rights, particularly in the documentation of torture and ill treatment. My professional work includes developing protocols, particularly the guidelines for my colleagues to work together according to the standard ways of documentation, and also training doctors in documenting any kind of abuse, violations, and of course serving as an expert witness. Along with this, I have been a human rights activist because I just believe that medicine must stand for truth and dignity for human beings. When I was 18, I had many physicians in the family, and they insisted that I have to be a physician, although I wanted to be a mathematician. In those years, when I studied medicine, it was 1970s and late 1970s and early 1980s. And there were serious atrocities in the country. Torture was a common practice, and many of my friends and family members were arrested, tortured, and some of them, unfortunately, passed away while they were in detention and tortured. So then I realized that ignoring the violence and injustice would be an obstacle for healing bodies, healing the people. So I decided that I have to work on these kind of human rights violations in order to protect the dignity of human beings. If you lose your health, then you suffer. We are, as medical doctors, are the instruments to end the suffering of human beings. And when we consider this, health and human rights is inseparable. Without freedom, safety, and dignity, people cannot achieve health, because health is not only the well-being of the body or the soul indeed, but in total, the social well-being, the political well-being is very important. And so we need freedom as we breathe. We need safety and in a certain dignity that we have to protect our freedom as human beings. And without health, human beings cannot exercise their rights fully. Science and health, of course, are not separable from the society because they serve humanity. And when we see the abuses that destroy lives, to remain silent is a betrayal for science and ethics. So, as a physician, in order to protect dignity, I have to be, and all the scientists should be, courageous enough when it is inconvenient and dangerous in many ways. Scientists are just following the truth and trying to reveal the truth. And they are targeted because truth is in many ways threatening the power. So, for example, a forensic physician like myself, when we document evidence of torture, this challenges the impunity that they exercise. So a public health scientist, for example, exposing environmental harm challenges profits and political interests. So why would they like to hear the truth? And why would they just stay calm and wouldn't target the scientists when they reveal the truth? In my own case, for example, I was imprisoned simply for raising my voice against injustice. This is not an exception, of course. This is a pattern, a broader pattern worldwide. So we need solidarity worldwide against the power that are uncomfortable for what they do to the world, to the human beings and humanity. If we know the truth, then we have to raise our voice and talk about the truth, whatever it is and whatever it would cost to us. When I was in prison, I received countless letters, statements that I have heard about throughout my law years, and messages from colleagues abroad. This solidarity was not only a source of personal strength, but also I have to admit that it was a shield of protection, because then the government witnessed the solidarity and the integrity of the scientific committee all over the world. And not only the scientific committee, of course, the human rights activists from all over the world was together with me, raising their voices about just arresting a human rights activist and a scientist for just revealing the truth. So authorities know that when the world is watching, they cannot act with complete impunity. So it is good to break the shield of impunity altogether in solidarity. The international advocacy is not symbolic. We know that it can save lives and careers in many countries. And we know that it reminds us science is a global community with shared values. And these values were just precious for all of us, for our dignity as human beings. And we know that science and medicine cannot flourish where human rights are under attack. And the global scientific community must always stand united, not only to defend individuals, but to defend the integrity of science itself. By supporting the colleagues at risk, promoting freedom of expression, and insisting on accountability, we protect the future of knowledge and the dignity of humanity. And we know that the power of individuals is not enough at all, but coming together in an organization, in an academy, in an association, in a union, sometimes a trade union, then the separate individuals' power come together in a geometrical exponents. So we have to keep in mind that being organized, have networks, is essential for human beings to feel powerful and just to overcome all the obstacles together instead of trying bit by bit as individuals. So it was very important for us to have this solidarity in organized ways, for resilience also, for personal resilience and the organizational resilience as well.